Hello, I'm Kathy Haas, one of the nurse navigators with Christus St. Patrick Hospital. Knowing your numbers is an important key to your health prevention and chronic disease management. You recently participated in a wellness screening where we took your blood pressure and performed some lab studies. I want to help you understand your results. What is blood pressure? The two numbers in your blood pressure reading indicate the amount of force that is pushing against your artery walls when your heart is contracting and when your heart is at rest. The first number is called the systolic number. This number represents the pressure in the blood vessels when the heart beats. The second number, or diastolic number, represents the pressure in the blood vessels when the heart is at rest. So what do you do to keep your blood pressure in check? Well, you eat a healthy diet, one rich in fresh fruits and vegetables, providing nutrients such as potassium and fiber. Also include foods that are low in saturated fat and cholesterol. Maintain a healthy weight. Being overweight can raise your blood pressure, and losing weight can help lower it. Limit your sodium intake. Healthy adults, limit your sodium intake to only 1 teaspoon a day. That is 2,300 milligrams of sodium. Adults with high blood pressure, you should have no more than a half a teaspoon of salt a day, 1,500 milligrams. People with congestive heart failure, liver disease, or kidney disease may need to even lower that amount of sodium. Always be physically active. Physical activity can help lower your blood pressure. So try to get at least 30 minutes of exercise on most days of the week. Stop smoking. Smoking injures those blood vessels by hardening the arteries. By quit smoking, you can lower your risk for heart disease or stroke. And limit your alcohol intake. Drinking too much alcohol is associated with high blood pressure. So men, limit yourselves to no more than 2 drinks a day. Women, no more than 1 drink a day. When we talk about lab work, the first thing we'll talk about is cholesterol. So why is your cholesterol important? Well, your body needs cholesterol to work, but levels that are too high can harm you. Extra cholesterol in your blood builds up inside the walls of your blood vessels, and this buildup can reduce or even stop the blood flow, may cause a heart attack, stroke, other serious heart or blood vessel diseases. Take control of your cholesterol with these healthy habits. Eat foods that are naturally low in fat, like whole grains, fruits, and vegetables. Choose lean protein foods, soy, fish, skinless chicken, lean meats, fat-free, or 1% dairy products. Limit how much fried foods you eat. And always avoid foods with the words hydrogenated, partially hydrogenated, or trans fat on those labels. Eat fewer egg yolks, hard cheeses, whole milk creams and ice cream and butter. Eat foods that are high in fiber like oats, bran, beans, cereals, and brown rice. Again, lose weight if you're overweight and try to get plenty of exercise. The second test we look at is your glucose. This is the sugar in your blood. It's an important energy source, and it's needed by all of our cells and organs of our bodies. Some examples are our muscles and our brain. And glucose, or sugar, comes from the food we eat. Carbohydrates such as fruit, bread, pasta, cereals are common sources of glucose. These foods are broken down into sugar in our stomachs and then absorbed into the bloodstream. So what are the warning signs of diabetes you need to look for? Frequent urination. If you have a sudden weight gain or loss. If you're excessively thirsty or hungry, have weakness or fatigue. You cannot explain your tiredness or drowsiness. You may have blurred vision or changes in sight. You may have slow healing, especially wounds on your feet. Frequent skin infections or dry skin that is hard to manage. There are some risk factors for diabetes that you need to be aware of. Are you 45 years of age or older? Do you get little or no exercise during a typical day? Are you African American, Hispanic, Native American, Asian American, or Pacific Islander descent? What about your family history? Do you have a family member with diabetes? If you experience one or more of these warning signs of diabetes, please see your healthcare provider for additional testing. Men, we ran a prostate-specific antigen test called the PSA. This test measures the amount of prostate-specific antigen in your blood. Healthy men usually have low amounts of PSA in their blood. The amount of PSA in your blood normally increases with age. PSA may also increase as a result of an injury, an inflammation of the prostate gland, or with prostate cancer. For women, we ran a TSH. This is thyroid stimulating hormone. It is a test for evaluating thyroid function and/or symptoms of hyper or hypothyroidism. A high TSH result often means an underactive thyroid that is not adequately responding to the stimulation of the TSH due to some type of acute or chronic thyroid dysfunction. A low TSH result can indicate an overactive thyroid gland, hyperthyroidism, or increased amounts of thyroid hormone medication in those who are being treated for underactive or those people who have had their thyroid gland removed. An abnormal TSH test results is usually followed by additional testing to investigate the cause of this increase or decrease. Another test we do is a CBC. Now, why is that important? The CBC can help detect blood diseases and disorders such as anemia, infections, clotting problems, and immune system disorders. Your RBC are those cells that carry oxygen from your lungs to the rest of your body. Abnormal RBC levels might be a sign of anemia, dehydration, which is too little fluid in the body, might be bleeding or another type of disorder. Your WBC are part of your immune system and they fight infections and diseases. Abnormal WBCs might be a sign of infection, a blood cancer, or another type of immune system disorder. Platelets are blood cell fragments that help your blood clot. They stick together to seal cuts and breaks on your blood vessel walls and stop bleeding. Abnormal platelet levels might be a sign of a bleeding disorder, not enough clotting, or a thrombotic disorder, too much clotting. Your HGB is an iron-rich protein and it's found in the RBCs that carry the oxygen. Abnormal HGB levels may be a sign of anemia or other blood disorders. Your HCT is a measure of how much space the RBCs take up in your body. A high HCT level may mean you're dehydrated. A low HCT level may mean you have anemia. Thank you for participating in this wellness screening offered by your employer. If any of your test results are abnormal, our recommendation is for you to follow up with your physician for further evaluation. If you do not have a doctor, please call 337-491-7577 and ask for a physician referral. Christus St. Patrick Hospital is proud to be your partner in wellness.